Hi guys, welcome to another interference cast, something a little bit different this time. Look, we're in the midst of a real crisis at the moment, so just like I did with the episode with Barry Alton, I wanted to bring another guest on that can bring something else to the table. So although I've got all the usual clinical and non-clinical but still related to dentistry stuff coming, I wanted to just bring this into the sort of a series that I'm doing at the moment about NLP. So I'm just going to warn you now that this is very different to what maybe you've ever done before. So just bear that in mind and enjoy it, relish it. It's something that is going to make you think a bit differently. If you've never sort of employed or used any NLP techniques, then this is a great opportunity to do so. I've got Jane Lelean on the show today, and she's going to talk me and the listeners, you guys and the watchers, through a technique whereby you can change how you feel in your response to a problem or an anxiety or a worry that you have in your life. So I hope you enjoy this short episode, but it's something that I think for those who are interested in cleansing this worry, whatever that uncertainty, I'm sure there's plenty of it going on right now. I'm hoping this episode will be impactful for you. For some of you, this might not be your thing, but try it. Don't knock it till you try it, because at the end of the day, NLP works in different ways. We're not quite sure 100% how it does work, but it's something that's quite interesting. So hoping you're gonna enjoy something a little bit different today. Thank you. Right, Jane Lelean, welcome to Protrusive Dental Podcast on this interference cast. It's great having you on. Thank you so much for coming today.
Thank you for inviting me. Absolutely, it's great to be here.
You're someone who I can see on the social media groups as a real beacon of positivity, and it's just so nice to have that. So I thought, why not bring you on so you can also lift the mood of all the listeners, because it's such an uncertain time for everyone. Can you just tell my listeners a little bit about yourself, please, Jane?
Absolutely. So I'm a dentist, and I think that needs to be really, really clear. I'm still registered, I'm still indemnified, and in fact, I'm the 111 dentist for Buckinghamshire this week. So I still do dentistry, and I'm also a coach. I'm a qualified, accredited, certified coach, which is very unusual for many coaches. They call themselves coaches and they've never done any training. So I'm registered with the ICF, which is like the GDC for coaches. And I work with clients doing coaching, training, and a little bit of mentoring. They're all very different. And at the moment, most of my phone calls from clients are, I've put my tools down, not sure I want to do dentistry any longer. So I'm getting a lot of career coaching that people want. Not surprisingly, I'm getting an awful lot of anxiety, clients that are scared, they're worried about the present, they're worried about the future. So I'm doing some what I call therapeutic coaching with them, which is about changing the mindset. So you often see on the social media that mindset of everything, you've got to change your mindset. And that's great, it's the what. And people don't know the how to. So what I do is I work with my clients actually changing the how to, so they know how to do it. And then, of course, there's conventional business coaching, that principles that in this time of uncertainty, there's maybe some crisis management, and many people are using it, tools down, skills up, and using it to develop their practice and their team so they're stronger when we do eventually open the doors. So yeah, that's what I'm spending most of my time doing at the moment.
Brilliant. It'd be great for the listeners and those watching if you can give us a little taster session now of some of the neuro-linguistic programming that you're known for, that you can give us a taster to leave us at the end of this short episode in a better state of mind.
Absolutely.
Going through the how.
Okay, so in order to do that, Jazz, can I take you through a process?
Sure, let's do it.
Absolutely. So I'm curious, one of the many, many things I love about NLP is it's content free. So I don't need to know what your issue is to be able to help you through it. And I think that's really important, because some people don't want to share, and that's fine. So I'm just curious, and maybe the listeners can do this at the same time. Do you have a situation, an issue, an experience that maybe causes you worry, concern, fear, that ultimately you want to change your response to so that you can perform in a better way. You can become a better version of yourself, because it's not about the situation, it's your response. I see you nodding, so you've got something.
Well, so I am now thinking of exactly what you described as something that is worrying me, and I want anyone who's watching this, listen to this, to also to be, I'm sure at this time everyone can think of at least a couple of things, but for homing on that one thing that's worrying you, causing you stress, so I can definitely think of something.
Fantastic. And just invite the listeners just to find something too, whether it's a worry, a concern, a stress. Okay, and once we've got that, I'm really not interested in the content. And also I want you not to be interested in the content, because in this exercise of NLP, what we're going to do is think about the structure of how you're thinking. Because when we change the structure of what we call the internal representation, your response or state has to change. And this is just one of many techniques that we can use to change the internal representation. Now, NLP is experiential. I'm just going to give you the heads up. As dentists, we spend a lot of time in our left brain cognitively, and we want to intellectualize and understand and work out how this works. Let it go.
I can definitely relate, yeah.
Absolutely, let it go.
Letting it go.
So this is just about the experience. So first of all, we're going to come to this with a place of curiosity. Because actually, I don't know your answers. Mm-hmm. And we're going to find them out.
Okay.
So, Jazz, I invite you to think about that thing.
Right, I'm thinking about it.
As you think about that thing, what I want you just to notice is there a picture that you see as you think about it? And if you find it easier to close your eyes as you do this, go ahead.
Yep, I've got a clear picture of my worry.
Okay, and I just want you to pay attention to the structure of those images. So that picture, notice how big it is. Okay. And
do you want me to verbalize it in terms of...
You don't need to, because that's not important.
Okay,
the fact is that you've noticed.
Mm-hmm.
So what I'd like you to do is now just change the size of it. So if it's massive and big, make it tiny. Mm-hmm. If it's tiny, just make it massive. Just change it radically.
We're going from like a cinema theatre to a small pocket watch type of thing in your mind.
Fantastic. So just change it.
Done.
And notice how close it is to you. Is it close up? Is it far away?
I'd never thought about a thought being in proximity to you, but yeah, it's very close. It's up in my face. So yes, I'm going to push it away.
Move it far away. Move it far away.
Done.
Brilliant. And I know it's far away and it's already, you're less able to focus on it, but pay attention now to the colours in that picture. Are they bright and vibrant? Are they pastel colours? Are they black and white? What is the quality of the colour?
Right.
And as you notice the quality of the colour, change it.
Okay. I've changed it to black and white.
Okay. Notice the picture. Is there movement in it, or is it still?
Okay.
And if there's movement, make it still. If it's still, make it movement. So
right. Okay. Fine. Mm-hmm.
Just changed it.
Changed it.
And notice in that picture, are you what we call associated it? So are you in it, or are you disassociated? So you're looking at it from the outside.
I'm disassociated. Yeah.
So whatever you're doing, change it. Make it different.
Okay. Mm-hmm. Done.
Is the one picture or multiple pictures?
Just the one.
Just notice and just try it on for size. Does your response to that change and improve if you make it multiple pictures or not?
It becomes difficult to focus, but that might be the point.
Okay, so if it's more, so, and I notice you're smiling now, so just do that. Separate it out and make it into multiple bits. Do these things have frames around them? And if they do, notice what the type of frame is. Is there a frame? Is there not a frame? And just change it.
Okay.
Now I notice that you've put it in front of you. So I'm curious about what happens if you move it to either the left or the right.
Interesting.
Did you learn to read and write in English?
I did, yes.
Okay. So just try to emphasize, does it make a difference, your emotional response, whether it's on the right or on the left, as compared to in front of you?
Definitely is a difference, yeah.
And is it more comfortable on the left?
It is.
So then move it also to the left and behind you and notice what happens then.
I feel
still more comfortable.
Yeah, I feel more distanced from it.
Okay. Just as a point for anybody that's watching this, listening to this, and they learnt to read and write in Arabic or Chinese, where we write the different way, they may find it's much easier to put it onto the right. So anything else about the quality of the image that you need to change to make it less emotionally responsive?
I think I can deteriorate that a bit.
Okay, so just make any tweaks and changes that you need to, just to reduce physically changing the quality of the picture that reduces your emotional response.
Done.
Okay, so now what we're going to do is we're going to pay attention to the sound.
Okay.
So as you have that thought that generates that picture, I now want you to pay attention to the sound. Where is the sound around you? Is it inside your head? Is it outside your head?
Mm-hmm.
And what happens if you move the sound to where the picture now is?
Mm-hmm.
And again, the quality of the sound. Is it loud? Is it quiet? What happens to your emotional response when you change the volume?
Interesting.
And what happens when you change what we call the timbre, the quality of the sound, the shrillness? So just imagine you're playing with a graphic equalizer that's got more sliders and things than you know what to do with. Just fiddle around with all of those things.
Yeah.
Just like you do on your podcast, you can change everything. So just put yourself in front of that deck and change everything that you can possibly change about the quality of that sound, so your emotional response changes.
And that's very interesting. I've had to do it in a way that I wasn't expecting, but yeah, interesting.
Okay. And now we're going to move on to the feelings. So I want you to pay attention in your body as you think about this thing that was previously causing you worry, concern. Pay attention to the feelings. Where in your body do you feel what you've described as maybe worry, anxiety, whatever your word was?
I mean, I'm happy to share this, but it's right in the core of my stomach.
Core of your stomach. Okay. And again, pay attention. How large is it? How small is it?
Mm-hmm.
Does it have a colour?
Okay.
Does it have a texture? If this feeling was something that was real, what's the consistency to it?
Mm-hmm.
And I want you to keep changing them. So you're changing the quality of the feeling. Out of curiosity, does it have a movement to it? Does it rotate? If it rotates, does it rotate clockwise, anti-clockwise, and change it.
Okay.
What about the rate of the movement? What happens when you either speed it down or speed it up? Slow it down or speed it up? What happens to the feeling?
You almost have to like visualize them both and see how it affects you one way or the other.
Yeah, you're having difficulty finding it now, though, aren't you? Okay, so now what I'd like you to do is, having changed that, just notice, is there anything else about the structure of that feeling that you can change or needs to be changed to reduce the emotional intensity that you were feeling? Okay, whatever you need to change, instinctively you'll know, and just change it.
Done.
Okay. So now what I'd like you to do is finally take that feeling and effectively reach in and take it out and put it with the pictures and the sounds. And because nature abhors a vacuum, just want you to fill that space with a white, healing, loving light. And move the feeling over there.
Done.
Okay, and goodness me, did you notice what happened when you did that?
Yeah, there's a little sigh of relief.
Absolutely. Okay, so that thing that you've moved, I'm just curious. How do you need to, because it doesn't serve you any purpose any longer. Would that be correct?
Yeah.
Okay, it's done. It has no purpose. So how can you package it, dispose of it? It's served its useful life. What do you need to do in your mind's eye to make sure that that doesn't come back?
Okay.
And whatever it needs to happen to that so it doesn't come back, just do it. Done?
Done.
Okay. So take a big deep breath. Now tell me how you feel at the end of this process compared to how you felt at the beginning.
I'd definitely say lighter would be the word, but the most profound change I had was distancing furthest away from me the thought. I mean, of all the everything that I experienced, having to think really quite differently to how I usually would do, associating colours and feelings and sounds to these things. But the biggest, most profound impact for me was actually moving it, meters and meters away from me and making it small. Just that, I think, had a big change in me. Like a weight had been lifted compared to I mean, everything else was incremental, and I can see the value of that. But that was a shift point that I'd noticed inside me.
Okay. And I want to park that because I want to come back to it, but I just want to test it. So what I'd like you to try and do now, Jazz, is just think about that thing again and just test it. Think about that experience and notice how you can't re-access those feelings that you had previously.
Yeah.
You can't do it, can you?
It's not. It's completely different to how that concern, that worry was.
Absolutely. Because this is the how-to. And I don't know, and I don't know how you configure your thoughts, which is why I completely leave it open for you to change them. And for all those people that are listening on the podcast, give you absolute free rein to change them so a way that it is more comfortable for you. Often I find, even myself, I've been an NLP master practitioner for 15 years. I often still need a coach to talk me through the stuff because it's much easier. Now, one thing I do want to pick up on, that I deal with an awful lot of clients with overwhelm. And if I'm doing one-to-one, I might invite the clients to tell me what's going on for them. I haven't done here because it's not relevant, and I need to show that people, I don't need to know, is that a very, very common pattern when people experience overwhelm, whether that they then describe that as panic or that inability to make a decision. People use different words to describe it. The pattern tends to be that the image is very large and very close.
Yeah.
And so that process of just moving it away and making it smaller just gives us space to see what else is going on.
Yeah, that was quite profound.
This is the how-to.
Mm-hmm. Brilliant. Well, I'm hoping people who were watching this were able to hopefully be engaged, close their eyes, and dissociate some of their worries.
Yeah,
and
please don't do this driving. We need to put that. We need to put that as a thing up front. Please don't listen to this when you're driving. No.
I'll be able to cut that bit from there to the beginning. Please don't do this while driving. So that's very interesting. So if people want to learn more about other techniques, where can they learn about them from?
Well, they come to me. Happy to either teach them or take them through the process. People want different things. They want to get in contact with me. My email address is jane@iodb.co.uk. So the website is the Institute of Dental Business.co.uk. And my telephone number is 07 989 757 884. And what I am doing, and I'm committed to do, Jazz, is that I know things are really difficult for many dentists at the moment. And I am really here to help and support my colleagues. And you've seen it on the internet. If people want a free call, help call, support call, all they need to do is ring, book a call, and they can have a full hour's free coaching just to help them get through whatever they need to get through. And for me, that's open to every single member of the team because everybody counts.
That's very sweet of you. And what I'd like to do as well is I'd like to put the Facebook group link in the description below so people can join that very positive, very beautiful Facebook group. That's just
thankful, grateful, blessed.
Yeah, thankful, grateful, blessed. It was nice to be on there and move away from all the other sort of business, COVID related stuff, and really see some nice content, nice words, nice visuals being sent from everyone. So a few
COVID-free zone.
Yeah, no, that was very, very nice. Well, Jane, it's been great having this exercise and learning about the how-to. You made me think in a way that I didn't think was possible, to be honest with you. But that was very powerful for me. It was, it might be different in someone else's experience, which part of that was most profound for them. But yeah, that dissociation in distance, I hadn't thought about it like that, and that was very cool. So thank you very much for introducing that to me.
We don't know what we don't know.
That's right.
But anyway, thank you for inviting me, and I'm wishing you all the best. And yeah, it's been great.
And
Thank you,
Jane. Thank you.